Welcome to Vigyan Setu Foundation, an effort for bridging science and society. The following presentation is a step taken by Vigyan Setu Foundation under its commitment to raise awareness in the society. Every year, World Rabies Day is celebrated to raise awareness about rabies prevention. 28th September also marks the death anniversary of Louis Pasteur, who developed the first rabies vaccine. The theme for 16th World Rabies Day is Rabies, One Health, Zero Deaths, highlighting the interlinking of the environment with both humans and animals. Now, zero deaths signify 0 by 30, the global strategic plan for the elimination of dog-mediated human rabies deaths by the year 2030. To realize this dream of no rabies, we get to know rabies. Rabies is a viral disease of all warm-blooded animals which is directly transmitted from lower vertebrates to human beings. Virus of rabies affects nervous system. Practically speaking, rabies is 100% fatal, but deaths can be prevented. 95% of the human deaths due to rabies occur in Africa and Asia. Though the primary reservoirs of rabies are the carnivorous mammals, but otherwise all mammals including wild animals are susceptible and capable of transmitting rabies virus. Roughly 4 centuries ago, Rahim the poet referred the mode of rabies transmission in a very subtle way through the couplet or doha, which goes like Rahiman oche naran so, bear bhalina preet, काटे चाटे स्वान के दो भांति विपरीत, which means the bite exposures or even non-bite exposures both are equally perilous. Bite exposures can be of varied degrees, like abrasion or scratch on the skin, mucous membranes exposed to saliva, but most frequently of these are the deep penetrating wounds. The non-bite exposures occur when rabies virus-laden saliva contaminates the abrasion, the open wounds, or the mucous membrane. Now let us understand how this disease develops. Since rabies virus cannot penetrate intact skin, it gains entry through the wound or direct contact of the infected saliva. After entering, the rabies virus starts making its copies within muscle cells or directly infect the nerve cells. From the site of the wound, the virus travels through the nerves and reaches the brain, where it starts multiplying. From brain, again it travels to the salivary gland for spreading the disease through saliva. Diagnosis of rabies is based on the history of bite or non-bite exposures of the suspect animal and of course the clinical signs. The incubation period of rabies depends on how severe or deep the bite wound is, how much of the virus has been inoculated, the immune status of the victim, and the number of nerves present at the site of the bite. The clinical manifestation of rabies or appearance of observable signs depends on this incubation period. In case of rabies, this is the time taken by the virus to reach from the site of the bite to the brain. And for rabies, this eclipse phase is highly variable. It can be from few weeks to many years. The symptoms of rabies are exhibited in 3 different stages as per their severity. The prodromal stage is when the virus is present in brain. The symptoms are non-specific like general malaise, fatigue, headache, weakness, discomfort, and prickling, itching, or burning sensation at the site of the bite. As the infection progresses, the symptoms become more and more specific due to acute encephalitis. The patient starts showing insomnia, anxiety, confusion, hypersalivation, difficulty in swallowing, hydrophobia, aerophobia, and even photophobia. And final stage is coma, which results in death. In dogs that have rabies infection shows change in their normal behavior, which includes biting spree irrespective of whether it is animate or inanimate objects, the unprovoked abnormal aggression, paralysis or incoordination in the movement, restlessness, lethargy, changed vocalization like hoarse barking or growling, or sometimes unable to bark or make any kind of sound, and excessive salivation, including foaming at the edges of the mouth. There is no effective treatment for rabies once the clinical symptoms appear. However, rabies can be halted by proper medical interventions through post-exposure prophylaxis. Post-exposure prophylaxis is a preventive measure advocated for anyone who has been bitten or scratched or licked by a suspect animal. World Health Organization has categorized these exposures and accordingly have recommended post-exposure prophylactic measures to be taken. In all the cases, you will see there is a wound management. This wound management has certain do's and don'ts which are suggested for category 2 and 3. In do's, one needs to wash the wound under running water. Wash the wound with soap and water and apply the disinfectant. And in case of category 3 exposures, infiltrate immunoglobulin deep inside the wound. However, under any circumstances, one should not touch the wound with bare hands or apply any kind of irritant like soil, chilies, oil, lime, chalk, betel leaf, or something like that. However, pre-exposure prophylaxis is also recommended, and which is for the high-risk group as a preventive measure. This high-risk group include veterinarians, persons attending to human rabies cases, laboratory staff handling infected material, wildlife workers, quarantine officers, animal technicians, and animal handlers and catchers, and of course, the most importantly, the animals. Rabies can be controlled through pre-exposure prophylaxis of animals, the population control of the stray animals, and public sensitization about animal behavior. How to avoid a bite in case of familiar dogs? Well, one must start interacting with the pups very frequently and teach them not to bite, developing a sort of bond with their pets. The dogs do not understand that biting is wrong, and they use biting as only a means of defense. So, with familiar dogs, one must empathize and approach or interact with them when it is safe. In case of unfamiliar dogs, when a dog approaches, one must stand still and keep quiet. Let the dog sniff, and when the dog walks away, start moving slowly in opposite direction of the dog. Stay away even when the dog is chained or on the other side of the fence. In any case, never tease, chase, or throw anything on a dog. Do not disturb an eating, sleeping, or nursing dog, and never hit, kick, or shout at a dog. Always maintain a safe distance from strangely behaving dogs. Now, to sum up, let's have certain rabies facts. Rabies is fatal once the symptoms starts appearing. Over 59,000 people die of rabies each year. Education is the key for rabies prevention. Wound washing is always life-saving. Vaccination against rabies saves lives. Vaccinating dog reduces the human infection. And reporting dog bite cases and suspected rabied animals supports the rabies elimination program. The newer technology improves access to rabies treatment in rural and hard to reach locations. And rabies is a success story for implementing One Health approach. So let us join hands to make 0 by 30 a reality. Thank you for watching this presentation. Hope you have liked it. You may share your comments and do not forget to subscribe our channel if you have not done so far.